Patient advocacy means that the nurse makes sure that the patient's needs are met.
Patient advocacy is doing what's right for the patient.
Patient advocacy is making the patient's safety a priority.
Patient advocacy is about speaking up and standing up for your patient's rights.
A patient advocate does what is within the patient's best interest. A patient advocate is an effective communicator and is willing to be assertive.
Patient advocacy is an important role that a nurse and all other members of the healthcare team must play in order to protect their patients. For example, in this case, we have a patient, Ms. Garcia, who is a 28-year-old Hispanic female that only speaks Spanish. She has come into the ER with her sister with complaints of abdominal pain that she has experienced for 3 days. After the patient is assessed, it was revealed that the patient has also been experiencing dysuria, pain during intercourse, has been bleeding unusually when she is not on her period, and has a family history of uterine cancer. After running some diagnostic tests, the patient is found to have uterine cancer. Now, the doctor and the nurse are here to tell the patient of her diagnosis. Let's see how the healthcare team handles this.
Good morning, Dr. Wawryzinski.
Good morning.
Just a heads up, this patient is Spanish speaking only, but sister's here to translate.
Okay, thanks for the heads up. Let's go in.
All right. Good morning, Miss Garcia. Good morning, Monica. I have Dr. Wawryzinski here to tell you about your diagnosis.
Hi, good morning, Monica. Good morning, Miss Garcia.
Hola.
Monica, I hear you are Miss Garcia's sister and you're willing to translate for me today?
Yes, I am. We've been actually anxiously waiting and would really like to know what's going on with my sister.
Okay. ¿Qué está diciendo? ¿Este es el médico? Pregúntale qué tengo.
Sí, es el médico. Ahorita te va a decir tu diagnosis.
Ah, okay. Gracias.
My sister wants to know what's going on and what she has.
Okay, so after considering your sister's symptoms and running some tests, unfortunately she has uterine cancer. We would like to get started on chemotherapy drugs right away in order to potentially improve her chances, okay? Please let us know if there's anything we can do at the hospital. We have a lot of resources here. Monica, if you can please translate to Miss Garcia, please.
Yes, el doctor dije que todo está bien. Nomás tienes una infección del tracto urinario. Te van a dar medicamento.
Gracias, doctora. Gracias, enfermera. Lo agradezco mucho. Thank you, sister.
Sí, sí.
Does she have any questions or need clarification?
Oh, no. She understands everything completely. Would you mind giving us a few minutes, please?
Absolutely. Take all the time you need, okay? Nice to meet you.
De nada. Bye-bye.
Thank you.
Bye.
Dr. Wawryzinski, that was so strange. I don't think her sister translated that correctly.
What do you mean?
She just took the news so well for such a terrible diagnosis. I don't know, it was just quite unexpected.
Hey, what's going on? How did Miss Garcia take the news?
That's what Ashley was just talking about. She thinks that Mrs. Garcia's sister translated what I said incorrectly.
She just took the news surprisingly well. She was even smiling afterwards.
Yeah, that can't be good. I think you guys need to get a certified translator to go in and tell Miss Garcia about her diagnosis. I'm perfectly fine going in with you guys to make sure she gets informed information about her diagnosis.
That sounds like a good idea. I'll get the sister Monica out of the room. That way you can speak to her privately.
Perfect.
Okay.
¿Cómo estás? ¿Cómo te sientes?
Hi, Monica. Do you mind if I have you sign some papers for your sister?
Sure. Yeah.
All right, come with me.
Buenos días, señora García.
Hola,
Mi nombre es
Lynn.
Silvia, soy la enfermera aquí del hospital. Acabo de oír que el médico se explicó tu diagnosis. ¿Sí entendiste lo que dijo?
Oh, sí, hola, sí lo entendí. Mi hermana me dijo que tengo una infección del tracto urinario y que me iban a dar un medicamento. Estoy bien.
Lo siento, señora, pero algo pasó durante la traducción de su diagnosis.
¿Me quieres hacer entender que el diagnóstico que me dieron no era correcto?
La traducción no era correcta. El médico te quería decir que después de considerar tus síntomas y después de hacer otros exámenes diagnósticos, ha encontrado que tiene cáncer uterino.
No puede ser. No. ¿Qué opciones tengo de tratamiento que me puedan ofrecer?
Te podemos empezar en quimioterapia. Lo más importante ahorita es que entiendas su diagnóstico y que sepas que hay recursos para ayudarte.
Ay, señorita, muchas gracias. La verdad es que aprecio que me han dicho la verdad. Me va a ayudar tremendamente a hacer decisiones informadas. Si podría tener un momento a solas.
Claro que sí, toma su tiempo. Cualquier pregunta que tienes, aquí estaremos, ¿ok?
¿Dónde está mi hermana Mónica?
Thank you, Miss Garcia.
Sí, gracias, güerita.
How'd it go?
It was rough, honestly. She took it pretty bad, but I still can't believe the sister translated incorrectly.
I know. Oh my gosh.
But you did a great work playing that out, Ashley. That vibe was different, you know?
Yeah, great work, Ashley.
Thanks. I had a real strong gut feeling, you know?
And that's always a good feeling to follow, you know? It's very important for us as nurses to be patient advocates and make sure that our patients get the right information about their diagnosis and make sure that they know that they have treatment options here.
Absolutely.
Sometimes families can translate incorrectly or use wrong terminology, so it's important for us to use certified translators from now on, so maybe incorporate that with your patients.
You're absolutely right. I'll make sure that I start doing that from now on. Standing up for our patients' rights to be informed is what patient advocacy is all about.
That's always a good feeling to follow, Ashley. You know, it's important for us as nurses to be advocates and make sure that our patients are properly informed about their diagnosis. Sometimes families can translate things incorrectly, use wrong terminology, so it's important that we get a certified translator to use to communicate with our patients. So it'd be good to use that with all of our patients from now on.
Standing up for our patients is what patient advocacy is all about. Patient advocacy is an important role that nurses play in the hospital.
Patient advocacy is not about telling the patient what they should do.
Rather, patient advocacy is about keeping the patient informed and helping patients weigh their options.
By doing so, we can help make sure that they can make an informed decision.
Nurses are the patient's main advocates, and it's always important to keep the patient's interests and safety a priority. One, two, three.
Wait. There you go. A patient advocate does what is within the best. Can you take it again?
Patient advocacy is about speaking up and standing up for your patient's rights.
Are you sure?
Wait.
Okay.
She's here to tell you about your condition.
Good morning, Miss Garcia, and good morning, Monica. Can we take it again?
Oh god. Time out real quick. Am I missing a line?
It's right here.
I'm like, okay, I don't know. She has a lot more to say.
Thank you, Miss Garcia.
Sí, gracias, güerita.
Communicate with our patients, and so it's good to implement. God.